1. A patient is ordered calcium gluconate for treatment of hypocalcemia. Which statement by the patient indicates a need for further teaching? A. I will take calcium 1 hour before eating. B. I will need to avoid eating whole grain cereals. C. I should drink a large glass of water each time I take my calcium. D. I will need to call my healthcare provider if I develop vomiting, constipation, or frequency of urination. Answer A. I will take calcium 1 hour before eating. Eber 2. Dosing of calcium with or after meals, not before, promotes absorption of the medication. Therefore, further patient teaching is necessary. Calcium salts should be taken with a large glass of water. Foods to be avoided include spinach, Swiss chard, beets, bran, and whole grain cereals. Patients should be taught the symptoms of hypercalcemia, such as nausea, vomiting, constipation, urinary frequency, lethargy, and depression, and should promptly notify the healthcare provider if these occur. The nurse should follow up on which finding if it is identified in a patient receiving periodic intravenous infusions of Aticept for rheumatoid arthritis. A. Itching and hives. B. Blurred vision and eye pain. C. Fever and malaise. D. Jaundice and dark urine. Answer C. Fever and malaise. 3. Abatacept suppresses immune function by reducing cell proliferation. Therefore, the patient is at greater risk for serious infections of the upper respiratory, gastrointestinal, GI, and urinary tracts. Fever and malaise are symptoms of infection that should be investigated. Itching and hives, blurred vision and eye pain, and jaundice and dark urine are not adverse effects of abatacept. A nurse is monitoring a patient who takes etanercept, Enbrel, for rheumatoid arthritis. The nurse should obtain the results of which laboratory test when evaluating for adverse effects? A. Arterial blood gases, ABGs. B. Skin test for tuberculosis, C. Electrocardiogram, ECG. D. 24-hour urine collection for creatinine clearance. Answer B. Skin test for tuberculosis.